Hello, everyone. It's Monday, April the 12th. We've had 8 additional deaths happen in West Virginia over the weekend that have been reported to us. I'm going to read those to you right now. Our 2,738th death was a 74-year-old female from Kanawha County. Our 2,739th death, a 62-year-old female from Ohio County. Our 2,740th death, a 65-year-old female from Taylor County. Our 2,741st death, a 66-year-old female from Kanawha County. Our 2,742nd death is a 73-year-old female from Harrison County. Our 2,743rd death is a 79-year-old male from Greenbrier County. Our 2,744th death is a 70-year-old female from Raleigh County. Our 2,745th death is a 95-year-old female from Lincoln County. That totals 2,745 people that we've lost in West Virginia, and we all know, and I've said it 1,000 times, but we all know that this deadly killer attacks our elderly primarily. The youngest person that I have today, regretfully, to report, of the people that we've lost is a 62-year-old. Every other age all the way up to 95. And this terrible killer continues to take our wisdom away from us. We've still got to stay on guard. We still got to wear our mask. There'll be a point in time when we'll be able to get rid of those masks. And nobody dislikes them any more than me, but at the same time, they are, for all that we know, they're a lifesaver. And first and foremost, we have got to listen to our medical experts because they're who they are for a reason. I'll never forget, years and years and years ago, I had this little lump right under my jaw. And it scared me to death. I was probably at the time 28 years old. So I went to a surgeon. His name is Dr. Cleaningsmith, Walter Cleaningsmith, in Beckley, West Virginia. He worked at a place that we all called the Medical Arts. And I went in to see him. It was just hard as a rock, and it just scared me to death. And I'll never forget saying to him, well, what do you think it is? He said, well, it's a lymph node. And I said, is there anything bad about that? He said, no, we've all got them. That's what you're supposed to have. If you had a cold or something like that and everything, that's exactly what it's doing its job. And I said, well, how do you know that that's what it is? Because naturally, I was worried about it being cancer. And he looked at me after I said, well, how do you know that's what it is? And he said, well, first you go to med school for 4 years, and then you do, residency, and then you do your fellowships. Well, he was being funny with his answer, but he was so right. How do we know we're supposed to continue to wear a mask? Well, the people that should know, they've been to med school and they've done their fellowships and they've done their doctorates and on and on and on. That's how we know. To the very best of all of our abilities, we have to listen to those that we call on at all times when we're sick, and they call themselves and we call them doctors. So we listen. That's what we should do. Please keep all these folks in your thoughts and prayers. They don't deserve in any way to become a number. We've had 293 new positive cases in the last 24 hours, and we didn't test a whole lot because our positivity number is at 6.79. Our cumulative number is at 5.23. We have active cases of 7,470. We don't have many more recovered cases. We have recovered cases 136,247. We have 271 people hospitalized and 82 in the ICU units. That's not changed much. We have 3 counties in the red. That's Boone, Raleigh, and Berkeley County. Raleigh County's been in the red a long time, Berkeley a long time, Boone now joins them. I give you reminders all the time that if you're 65 years of age and older, you absolutely need to stay on your toes all the time. You need to get vaccinated. Absolutely, without any question, you need to get vaccinated. And with that, that in itself will give you an incredible insurance policy. But from the standpoint, if you've not been vaccinated and you have a kind of sniffle or anxiety or whatever it may be, you got to go get tested quick. And then if you're tested and when we by chance find out that you're positive, we'll get you the antibodies and save your life. Our vaccine eligibility, we're now trying to vaccinate everybody 16 years of age and older. From the standpoint of registering into our system and so we can facilitate better and everything, we surely encourage you to do just that. From our young people, I'm still continuing to urge those that have been vaccinated or the elderly or their moms or dads or grandmas or granddads or whatever it may be, uncles, aunts, whatever, please encourage these people 16 years of age to 35 to go get vaccinated. You could very well not only save them a lot of complications, maybe even their life, but you could absolutely help them be a part of stopping this terrible killer as far as the continuation of the spread of it. Our vaccine distribution update, we're at 90.2%. The goal is always 100. We have now vaccinated 1,096,787 doses have been put in people's arms. 661,000 and change West Virginians have gotten the first dose, and 461,000 have gotten the second dose. So far, the people that are 65 years of age and older, 256,818 have been vaccinated. 216,338 have been fully vaccinated. And God above knows that we saved a pile of lives right here because we moved. We moved when we had the choice to be able to do something, we did it. My goal is to get us to 85% of those individuals. We're above 75% now. We need to continue, and you can help us, West Virginia. You can help us if there's a neighbor or someone you know and they're wanting to get vaccinated, please just call us and we'll facilitate that and make it happen. From a standpoint of our manufacturing outreach, and this is the same for all types of different businesses and everything, or schools or ball teams or whatever it may be, we're constantly looking for arms to put vaccines in. If you'll call us and get, whether it be a church, the pastors at churches and everything, if you'll just call us and say, we'd like, you to come and take care of our congregation, our employees, our kids at school, whatever it may be, we'll come. But you got to give us the call and everything and get all this lined up and everything. It'll make things easier on the folks that are around you to be able to get vaccinated. The vaccine info line, is all up. The vaccine reminders that I tell everybody over and over and over to continue to wear your mask and absolutely continue to get vaccinated. This thing of people scaring, folks about not getting vaccinated, it's not smart. And here's another point. That really you should think about. You may be sitting there thinking, well, now that there's been a bunch of people get vaccinated, I can slide by and just not get vaccinated. I can get by without getting vaccinated and everything. Oh, what a chance you're taking. Oh, what an incredible, incredible chance you're taking. Not only do we still have the COVID-19 situation to deal with, but now we've got all the variants, and the variants absolutely are double down as far as the infectious, or double down the probability of death. oh, what a chance you're taking. If I were the only single person that wasn't vaccinated, the only one, and I felt like that the chances of me getting this were almost nil because everybody else was vaccinated, I'd run to get the vaccine. I'd run to get it because, man, goodness, if you get this, the price you'll pay is unbelievable. And so please consider going to get vaccinated. As far as the testing, it's all up there and everything. You've got all kinds of free testing. It's absolutely painless and everything. We encourage people to continue to test. As far as the drive-through pharmacy stuff, Fruth and Walgreens, what a job they've done. We thank them every day. We have 10 outbreaks in our long-term care facilities. We have eight outbreaks in our church communities in 6 counties. That's Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh counties. We got to double down on our churches and everything. Our church community has been fantastic. Keep that pew in between you. Keep your absolute mask on at all times, and try in every way that you possibly can to just think, we're still not quite through this and everything. If you're 65 years of age and older, you still may want to continue to get your services online. And I'm sure the good Lord above understands. And, we're going to get through this, but we need you vaccinated and absolutely with all ends. We need you to be safe and take caution with all the different things that we've been telling you. At corrections, we have 101 inmate cases and 11 staff cases right now. 36 at the Southern Regional Jail Facility, 34 at Salem Correctional Center, and 23 at the South Central Regional Jail. As far as the guidelines and everything, we've been telling you that all of our guidelines are posted over there on our website all the time. As far as the face covering, we know that that's the first line of defense. All of our experts continue to tell us just that. And I encourage you over and over and over about giving blood. We had a great announcement about our remote worker, program, and a special thanks to Brad and Elise Smith and everything for stepping up and doing great stuff in regard to that. And it's just more and more good developments within the state of West Virginia. But I thank you so much.
All right, thank you, Governor. Our panel of experts is joining us today, including Dr. Clay Marsh, Dr. Inam Jad, Secretary Bill Crouch, and retired Major General Jim Hoyer. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is a question, I guess, for the medical experts, because it's a situation I've run into that I didn't know exactly how to deal with it. And it circles around someone who presents a faith-based argument against getting the shot. So, Dr. Amjad or Dr. Marsh, what's the best point or debate or argument you can make to someone who comes up with you with faith-based concerns about getting the vaccination?
Dr. Amjad or Dr. Marsh, y'all go, please.
Maybe you want to start on?
You can go first, Clay, and then if I have anything. Thanks.
Yeah. So thank you, Kenny. I mean, we certainly, as the governor said many times, and we all have said, that taking a vaccine, choosing to be vaccinated, is really not only choosing this for yourself, but it's choosing this for your family, for your community, for your parish. And I think that one of the issues for me that's so important with our faith-based community, and we've seen incredible leadership in this community, is that many parishioners are watching the heads of the parishes, whether it's the pastors or the reverends or the priests or the bishops and others, waiting to see if they feel safe in taking the vaccine. So certainly we would never want people to move against their faith. And there's different people with different perspectives, which we certainly will absolutely respect. But certainly these leaders of these congregations are so important to promote the safety and effectiveness of these vaccines that we've seen all over our country and in our state, is we've seen the numbers of older West Virginians have been vaccinated now dying at a much lower frequency, getting infected. Less likely we're seeing that shift to our younger population. And there's many communities today and many people that are still nervous or haven't chosen to get the vaccine. And we would certainly rely on the leaders of our faith-based community to be those role models and to help those people if they are so capable or oriented to choose to get the vaccine, because we know the only way that we protect West Virginia, as the governor said, is trying to have every single West Virginian choose to be vaccinated when it's your turn.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question's for Dr. Amjad. Last week, you said that the DHHR had begun the process of looking at different vendors for the electronic death reporting system. Now that we've begun that process, I was wondering if you had a better idea of what that system will cost, a little bit about the different features that these different vendors offer, and when we can get that in there. Thank you.
Sure, Charles. So we're looking at something that can be implemented rather quickly. So, when electronic record systems, they can do a lot of stuff. So they can do marriage certificates, birth records, death certificates. They have different cloud-based systems. We've evaluated a handful of vendors right now. We want to implement it rather quickly. A lot of them give timelines anywhere from 6, 9 months, et cetera. We wanted to do a skinny formula, we called it. So we are in the process of evaluating several things on paper right now. We have done demos with, I think, 2 or 3 so far right now. So we are in the process of evaluating a handful of them to see which one that we can do, as I said, a skinny formula to implement a death record one only, and then adding other modules such as marriage or other ones later, because we want to do the death certificate one as quickly as possible. So that's the stages that we're in right now. But we basically evaluated a handful as quickly as possible in a very short time so that we can get it done as quickly as possible. But that's the stage that we're in right now. Thanks.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Greetings, Governor and cabinet members and fellow reporters. The number of active cases today is at 7,470. We have not had a number that high since, I believe, February 26th. And this is probably 2,000 active cases higher than we had just 2 weeks ago. How much is this due to the variant strain? Are younger people getting it? And can you give us updated numbers of how many variant strain cases we now have in West Virginia? Thanks.
Mark, I think this is going to have to go to Dr. Amjad or Dr. Marsh, but I can tell you this, Mark, that this is exactly what we're experiencing all across our country. And that's why I come before you 3 days a week, and I sit here Monday, Wednesday, and Friday, and I plead with you to go get vaccinated. I plead with you to wear your mask. We surely have folks that don't like the mask, and they're advocating we ought to get rid of the mask and everything. Well, I would tell you this: I don't like the mask, but it doesn't really matter. What we should always do is do what I said earlier and listen to the experts. And our experts are telling us hands down, getting rid of the mask. Are you kidding me? Right now, are you kidding me? So we're going to have to listen to our experts. That's exactly what we should be doing. But Dr. Amjad or Dr. Marsh, maybe you can answer, but I know what they're going to answer. They're going to say, yeah, we're dadgum concerned. Anybody that's not concerned is absolutely foolish right now. But anyway, Dr. Marsh, please answer.
Okay, I'll start again, Ian, and you can add in if you want. So the last numbers that I have for the variants are 168 for the California variant, 194 for the United Kingdom variant, and 1 for the South African variant. And certainly as we are looking at the new cases and spread, we are seeing our younger West Virginians as responsible for a larger percent of the spread. And this is now going to our 10 to 19-year-olds or 20 to 29-year-olds. And we're even starting to see some positive cases in our 0 to 9-year-olds. And so as we look at the variant viruses, we know these viruses can infect much more easily, as the governor said, including children. So children aren't protected from the spread of these variants, which is really important as the United Kingdom variant becomes the single most common variant in the United States. We may not be quite there yet, but it's growing in West Virginia as well. But also, I think people are getting lax about wearing face coverings and staying distance. And we know that, for instance, sports teams and high school students, we're seeing more spread related to that age group in the school organizations. But the classrooms still appear to be very safe, which is really important to us. But it is really super important that not only do we choose to be vaccinated for all West Virginians over 16 years old, but also that we continue to wear our face mask and physically distance. I don't know if you have anything else you want to add.
No, Clay, I don't. Thank you.
Great. Thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor, panel, fellow reporters. Governor, I'd like you to take a look at the recently concluded legislative session from your perspective in COVID-19. Do you think the legislature did anything that will help your powers, diminish your powers, and perhaps do anything that would put West Virginia on an even better track without touching on the tax proposal? Thank you.
Oh, Paul, I was having a little bit of discussion earlier with my folks here. I want us to be transparent all the time. I've not wanted, I've surely not wanted, and nor do I ever want to be the king. I want oversight, and I welcome that. But at the same time, when asked for the very first time about the executive powers and stuff like this, I was surprised, to tell you the truth, because I thought, well, why in the world are we spending time on that? I mean, really, we have handled the pandemic by every parameter that you can come and measure it with. We have handled this thing as well as any state, anybody, anywhere. We all know that. And with all of that, at the end of the day, whether it be the economics, we've not had pet projects, and we've not done anything whatsoever from the standpoint of the lack of transparency. We have solicited every kind of input from the legislature, anything and everything, from the medical experts and on and on. But at the end of the day, Paul, we had to make decisions where people's lives were on the line. We couldn't go around and go through 14 committees and everything. Somebody had to make a decision. And we made them, and I'm very, very proud of the decisions we made, from the standpoint of the health and safety, and absolutely from the standpoint of the economics. So I hate like crazy that we had displays of vulgarity and terrible language and people running up and down the halls and everything. I really commend our Senate for wisdom and just what they are, their wisdom, and so it seemed to me to be in the situation with the way we were handling things. It seemed to me to be just a lot of time wasted that we could have been doing a lot of other good stuff. And as far as as things that were done to make things better for the people of West Virginia in regard to that, I can't imagine that there was much good that came out of it. Now, as far as doing things along the way, that made things better, we did things like telehealth. That surely made things better. We did things, that would make things better from the modernization stuff with our restaurants and our bars and things like that. We did things that were still safe and absolutely made things better for our people. And so all of that was great, but from the standpoint of the very thing, and I've said it 1,000 times, at some point in time, there'll be a point in history, and you mark this down, Paul, there'll be a point in history when we look back on the fact of what happened with our personal income tax, and we look back with regret like we can't imagine. It was the miss of all time, and it turned into a grandstanding circus, did it not? And so what my plans are is to go and try to continue the fight and try to continue to educate our folks and our people. And at some point in time, we'll understand that we had real wisdom going on in the Senate and not a lot of wisdom going on in the House, to tell you the truth. But nevertheless, we don't need to continue to rub salt on a wound. What we need to do is we need to be all big boys and big girls and try to move forward and continue to do what we're here to do. And that's good stuff for the state of West Virginia. And that's what I'm going to do, Paul.
All right, thanks, Paul. Next to Taylor Stuck with the Herald-Dispatch.
Governor, I was wondering, do you have any concerns about Senate Bill 334, which health experts have said will make it very hard to operate syringe exchanges in the state? I was wondering if you've consulted with your health panel about it. I know Dr. Amjad has some experience with syringe exchanges. And just wondering, with the outbreaks of HIV in Charleston and Huntington, what you maybe plan to do with that bill.
The only thing that I can say, because I am not an expert in this field at all, but I really believe that everyone kind of came together on this thing and developed a real good scientific balance that it really still can aid and help the public in every way, but it does so with good science and everything, and it absolutely it prevents the problems that we were having with needles all over the place and different things that could cause all kinds of additional problems to communities, but it still aids in helping those folks that we need to reach out and try to help and keep them safe too. So I thought really and truly, for what I understand and I know, that it was a good balance and they did a good job.
All right, thank you, Taylor. Next to Junaid Dill with the AP.
Hey, everyone. Thanks. I'm wondering if the state is running into any vaccine hesitancy, especially with the remainder of senior citizens getting vaccinated. And in general, what are the challenges to getting, above 75% of senior citizens? What are the challenges the state's running into? And also, does the state want more vaccines still from the federal government, or is the vaccine allocation pretty satisfactory right now? Thanks.
Junaid, I'm going to pass to General Hoyer, but before I do, I just say just this. You hear me 3 times a week. Any place else you hear me, when there's someone that comes up, a reporter, and asks a question and everything, I'm saying the same thing over and over. I've been doing it for a long, long, long time. And really and truly, at the end of the day, the rah-rahing that we do has really been helpful. The marketing that we do, the transparency that we have has been very, very, very helpful. West Virginia, of all places, probably had the chance of being the state with the biggest hesitancy, in regard to taking the vaccine. But we've got to continue to be transparent and tell the truth and message to our people every time we get a chance that they got to take these vaccines. And in not doing them really can cause catastrophic problems. And so General Hoyer, join in there, please.
Yes, sir, Governor. Yeah, Junaid, as the governor pointed out, is there hesitancy? Yes. Are we way above where we thought we, the state of West Virginia, would be based on the efforts that he's made, that he's put on us as a leadership team, and that community leaders have helped us with? As far as vaccine availability, we're getting plenty of vaccine supply from the federal government, both in the direct shipments that come to us that we control and still get, shots in arms each week. But there is a lot more opened. All of the federally qualified health clinics are now being opened up to receive vaccines. More pharmacies are being opened up to receive vaccines. The VA has a significant supply for veterans who will register with the VA. So we believe we have plenty. We are working hard with the governor daily to again get the word out and educate folks as to the value of the vaccine, not just to them individually, but to us as a state, and what this shows the rest of the country about West Virginia being a great place to come and do business and live. Thank you.
All right, thank you, Junaid. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. One of the few facilities, possibly the only facility still not reopened to the public, is the building that we're in right now, the Capitol, the People's Building. Is there a timetable for reopening the Capitol at this point?
I'm waiting, Phil, till I get a little guidance here from the folks that are here, but I think that this building is absolutely not closed, and I think it is closed to tour groups, but I as far as official business that goes on here, we're absolutely open for official business, and I think what we're doing as far as tour groups and whatever like that for right now, we're just being wise and prudent in what we're doing.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, I really don't have anything else to report today. I hope and pray that everyone will stand steadfast in their prayers for the 2,745 people we've lost in West Virginia. And I hope and pray that all of us will absolutely try to solicit and help us to get more and more and more people vaccinated. Whether they be our young or they be our elderly, we need to get them vaccinated. That's all there is to it. At the end of the day, we've got the vaccines now. We absolutely prayed in every way that we would get the vaccines, and now we have them, and we're running upon, just like I'm sure a lot of other states are doing, but now we're running upon a hesitancy as far as, people, us being able to find additional arms to get these vaccines in. We still got a long ways to go here. I just read 8 more deaths today. I'm sure Wednesday it'll jump up because the reporting over the weekend sometimes lags a little bit. But just think about it. I go back to mine disasters. The Sago mine disaster. I think there was 12 miners, trapped there, and 11 out of the 12 were found dead. You know, I go back to things that have happened, you know, a bad car accident, whatever it may be. You know, we're reading probably in excess of that almost every day. And there was days not long ago when we were reading multiple times that. You know, so we've still got a ways to go here, West Virginia. You know, dropping your guard is only going to lead to more and more troubles. Absolutely, please. I don't know how many times I've said it. And to be perfectly honest, just like everybody, we're all tired. But please go get vaccinated. It is absolutely going to probably save your life, if not yours, maybe somebody around you. And none of us can put a price tag on that. So anyway, thank you so much, and we're just going to keep at it. We're going to keep at it and everything until we get this thing totally whipped. We got it on the run, but we don't have it whipped yet. Thank you so much.